Do you know how many teams there are who are 100% vaccinated and know what their vaccination rates are? Do you get a report for something like that, Dr. Sills?
Yeah, we do track that very carefully, Rich. And right now, today, around the league, we're at about 93% of all players being vaccinated. And that's even after the cut downs, which, of course, was one of the things we were tracking is there was some discussion about, as teams reduce their roster, that they might have a smaller percentage. But the percentage of vaccinated players is held right at 93%. And, of course, with our staff, it's virtually 100% that all our staff are vaccinated. So we're pleased with those numbers. Obviously, we're going to continue to work on them, and I'd love to see them continue to go up. But that's where we are as we approach the start of the season.
Do you know how many teams are actually 100% vaccinated, Dr. Sills?
I think there are two. I would want to just verify that. I think there are two. But, again, that's something that's changing every single day, Rich. We're still seeing teams that are having those conversations, having education, and seeing players step forward. So it's a very dynamic statistic. And I feel like we'll get to some others that do hit that milestone.
What do you do to get the 7% to take the jab here? I mean, what can you do? What is the message essentially to players who are still wondering?
I think it's just like we do with our patients in the office. I mean, Rich, I'm still a practicing physician, and so it's the same approach. You have patients who come in, they have questions, and you just need to walk through their concerns and share with them the data. I'm a big believer that no one ever gets shouted into belief about these types of issues. So I think it's about having a measured conversation and understanding their hesitancy and trying to address and show that data. And so, as I said, we continue to do that at the club level. I think it's also really important to have a trusted messenger, someone who's thought of as reliable and has a good grasp of the situation. And so that's going to be different for each individual and in each club. But as I said, those conversations are still ongoing, and I've participated in a number of them myself. And again, that's not that different than what we're seeing in the rest of society. This is certainly not just an NFL issue.
That was my next question. Have you personally been reached out to by a player who is doing their fact-finding? We've heard players say they need more information. Has a player picked up the phone or asked for your number and called you?
Yes, multiple times. That's happened really over the course of the past few months, and I really enjoy those opportunities. Certainly, as I said, a lot of our team medical staff's engaged in that, the NFL Players Association and their medical advisors. But I really, I've enjoyed those conversations because, again, players are just like patients. They want information. They want to have their questions addressed. And so that has been a part of my job over the past few months.
Dr. Alan Sills, the NFL's chief medical officer here on the Rich Eisen Show. How has the Delta variant changed the protocols and the approaches that you are attempting to put into place along with the Players Association?
Well, it's definitely changed the game a bit for us, Rich, in terms of how much more transmissible and the fact that it changes the symptom profile a bit, particularly in vaccinated individuals. So we're really doubling down and emphasizing the importance of symptom reporting. And I think that's an ongoing challenge, again, not just for the NFL, but the country as a whole. People that are vaccinated, if they get a little bit of nasal congestion or a sore throat, they don't always think of it as being COVID because they think, wow, I'm vaccinated, this must be something else. Maybe it's my allergies or I picked up a cold somewhere. So we've seen many of those cases turn into be COVID-positive cases simply because vaccinated people have milder disease. They don't have the same disease they had back in 2020. Last year when somebody was COVID-positive, they were unprotected. You saw high fevers and chills and loss of taste and smell and people that just really felt terrible for a few days to even longer. This year, again, if you're vaccinated, it tends to be much milder illness, shorter in duration as well, thankfully. And so it is a challenge to get people to speak up and say, hey, yeah, I want to get tested because, we do know that's one of our best methods for identifying infected individuals. If somebody with symptoms will walk forward and get tested. So we're doubling down on that. And again, that's not just a player issue. That's for staff and everyone in our environment.
So vaccinated members of a team, staff, players are going to get tested this fall, starting when? Like what? I know that it was once every 2 weeks. Is that going to be now once every week? Because of the Delta variant?
Yeah, we've changed that cadence to once per week, right. And we're dividing the pool of tested individuals into 3 different days so that we're testing multiple people over time, kind of getting a snapshot. And then we'll continue on with the daily testing of unvaccinated people. We also do daily testing of what we call targeted groups. So if someone is exposed, whether they're vaccinated or not, if they have a close exposure, a high-risk close contact to a case, we will test them daily as well for 5 days. And then, of course, anyone with symptoms, as we mentioned, or maybe someone that shares a household with someone that's currently infected, we're going to be testing them. So all told, we'll be testing over 1,000 people every day in the league. But the routine surveillance testing that you mentioned for vaccinated individuals, that'll be once per week for each person, unless they'd like to do more. They have the option to request a voluntary test more frequently, or if they have a high-risk person at home that they're concerned about, they can be tested anytime they request.
So if a player is vaccinated and is deemed to be a close contact of somebody on a Wednesday during an NFL week with a game coming on Sunday, what happens? Walk me through what happens for that vaccinated player.
For that vaccinated player, they're going to continue to come to the facility each day. They'll test on their way in. Mm-hmm. We will usually put them in a mask for the following 5 days whenever they are inside. And again, that's if they are a high-risk close contact. If we think they really had a substantial exposure to someone that's infected. Mm-hmm. We also do enhanced screening with them. So they have a personal interview each day. We go through a list of screening questions and make sure they haven't developed any symptoms. So there's additional testing, there's masking inside, and there's that screening process. And that continues on for 5 days for the testing and masking, 8 days for the screening process. But importantly, they're still allowed to come in the team facility, participate with the team, play in the game if that's relevant, as long as they don't have any signal on any of those items that we just mentioned.
Now, walk me through what happens with an unvaccinated player that is deemed to be a close contact on that Wednesday of a game day week. How is it different?
Yeah, if they're a high-risk close contact, they're essentially under the same protocols we had last year, Rich, 2020. And that's because we saw so many people who were not protected who had that high-risk exposure and then converted and became positive on testing. So if they're unvaccinated, they're actually out of the facility for 5 days. They will continue to test each day to make sure, obviously, that we don't detect any signal. But they're not allowed into the team environment. And again, that's strictly based on what we saw last year, where many of those individuals eventually turned positive. And if they did, it happened within that 5-day window of time.
So a vaccinated player who's deemed to be a close contact, high risk, as you mentioned, on a Wednesday has a shot to play on Sunday, but an unvaccinated player, that's it, out because it's a Wednesday and 5 days?
That's exactly right.
Okay. So what do you say to somebody who will then come out and say that's unfair to the unvaccinated player? What do you say to somebody like that?
Well, again, all of our protocols are based strictly on one guiding principle, Rich, and that's trying to keep the team environment as safe as we possibly can. Last year and also this year, we said there are going to be positive cases. Again, whether they're among vaccinated or unvaccinated people, as long as this disease is endemic out in society, we're going to see some positive cases. What we're trying to do is identify them, keep them isolated, and mitigate the risk to everybody else in the building. So all of our protocols are strictly built around the idea of what works to keep the team safe. How do we keep the team safe? And certainly what we learned last year through our data was if you're unvaccinated and you have one of these high-risk exposures, again, we're not just talking about passing someone in the hallway. We're talking about a substantial amount of time you spent within a very defined distance with a positive individual. Your risk of converting and becoming positive is significant. And because of that, we don't want that person walking around in the building and potentially spreading this to others. So, again, our protocols are not about punishment or distinguishing people, based on choices. It's strictly what can we do to keep it as safe as we can for everybody involved.
Science, facts, basically is what you're saying.
That's exactly right. Yeah, we've taken the data and we've tried to let the data lead us. And the reality, Rich, is, the part that I didn't say is, if you're unvaccinated, you are at a higher risk. If you are unvaccinated and you get exposed, particularly to Delta, in a close manner, you have a really high risk of catching it. It's just very transmissible. So we're just trying to protect everyone, including the person who's exposed, but also, obviously, as I said, the larger team environment.